So the first 80 pages, 1 to 82 pages of the Govind pareekh, this Ayurveda guide, it's very useful. Okay, the concise things of the Ayurveda, it's are all mentioned in the first 80 pages. Okay, if you study this first 80 pages, it's very good for all the competitive exams. Okay, like constricted way, they have given all the points. Okay, so first of all we'll be seeing like all the acharyas they have mentioned, each and every point, each acharya, what are the things are mentioned, they have mentioned in the first 80 pages. Okay, so very important, this first 80 pages. So starting with the Trisutra. Okay, this Trisutra, that is Hedu, Linga, Aushada. These three are considered as the three sutras. If we study these three things, then we can become a better physician. Okay, Hedu, Linga, Aushada. Hedu means Nidana for getting the disorder. Linga, Lakshanas of the disorder. Aushada, medicines of the disorder. If you know these three things of the basic three principles, then we can treat the patient. So that these three are considered as a Trisutra or otherwise Triskanda. Okay, Trisutra, Triskanda, both are same thing only, Hedu, Linga, Aushada. Next one is Tridanda, that is Sattva, Atma, Sharira. These three things are togetherly called as Tridanda. Then Tristuna, Vada, Pitta, Kapha, which means our body has made up of these three pillars, Vada, Pitta, Kapha. By these three things, by these three doshas, our body has formed. So that is called as Tristuna or otherwise known as Tristamba. Okay, Tristuna or Tristamba, both are same only, Vada, Pitta, Kapha. Then Traya Upastamba. Okay, Traya Upastamba, that is Ahara, Nidra, Brahmacharya. These three considered as a Traya Upastamba. This is according to Charaka. Okay, according to Charaka, Traya Upastamba is Ahara, Nidra, Brahmacharya. But according to Ashtanga Hridaya, Ahara, Nidra, Brahmacharya, like that word he has mentioned. Okay, that you have to note down. According to Charaka, it is Ahara, Nidra, Brahmacharya. But according to Ashtanga Hridaya, Ahara, Nidra, Brahmacharya, like that, and one word he has mentioned. Okay, Brahmacharya, that is mentioned by Ashtanga Hridaya. These three considered as the Traya Upastamba according to Vagbhata. Okay, according to Vagbhata, Ahara, Nidra, Brahmacharya. According to Charaka, Ahara, Nidra, Brahmacharya is the Traya Upastamba. Okay, then Triskanda, Hedu, Linga, Aushada. Skanda Traya is Hedu, Dosha, Dravya. These three are considered as the Skanda Traya. So these are some of the three, with that some terms they have mentioned. Okay. So from this also you can get questions. Okay, Trisutra is Hedu, Linga, Aushada. Tridanda is Sattva, Atma, Sharira. Tristuna is Vada, Pitta, Kapha. Tristamba is also Vada, Pitta, Kapha. Traya Upastamba, Ahara, Nidra, Brahmacharya according to Charaka. According to Vagbhata, Ahara, Nidra, Brahmacharya. Then Triskanda, Hedu, Linga, Aushada. Skanda Traya is Hedu, Dosha, Dravya. Okay, these are the things. Next we will be moving to the Dhumapana. Okay, very important, Dhumapana. According to Charaka, three types of Dhumapana he has mentioned. Okay, three types. According to Sushruta, 5 types. According to Sharangadhara, 6 types. Okay, what are the classification of Dhumapana? According to Charaka, 3. Which are the 3? Prayogiga, Snaihiga, Vairejanika. Okay, these are the 3 types of Dhumapana according to Charaka. Prayogiga, Snaihiga, Vairejanika. Okay, Sushruta has mentioned 5 types. Okay, which are the 5 types? Prayogiga, Snaihiga, Vairejanika. Additionally 2 Dhumapana, that is Kasakna and Vamaga. Okay, Prayogiga, Snaihiga, Vairejanika, Kasakna, Vamaga. These are the 5 types of Dhumapana according to Sushruta. Then according to Sharangadhara, 6 types. Okay, so he has mentioned a different terms. Okay, instead of Prayogiga Dhumapana, Sharangadhara, it is mentioned as Shamana Dhumapana. Okay, the term is different. Okay, instead of Prayogiga, he has mentioned the term is Shamana Dhumapana. Instead of Snaihiga, it is a Mrudu Dhumapana. Instead of Vairejanika, it is a Tikshna Dhumapana. Okay, Prayogiga means like a practical way we used to give medicines for Shamana purpose. No, in that way you can make the term Prayogiga Shamana. Snahika means we are giving oil, all those things, so that will be creating moistness. So it is a very soft in nature. So mrudu. Okay, instead of snahika, he has given the term mrudu dhumapana. Vairejnika, it is a shodhana purpose. For shodhana purpose, we used to give tikshna dravya. So instead of vairejnika, he has mentioned the term tikshna dhumapana. Okay, in that way you have to remember these three types of Dhumapana. So instead of Prayogika, he has mentioned Shamana. Instead of Snahika, Mrudu. Instead of Vairejanika, Tikshna Dhumapana. Then Kasakna, Vamaga. Then additional one Dhumapana he has mentioned is Vrana Dhumapana. Okay, as a classification, Vrana Dhumapana is included by Sharangadara. But Sushruta also mentioned about Vrana Dhumapana. Okay, Vrana Dhumapana, Sushruta also mentioned in the Chikitsa Sthana, but he has not classified under the classification. Okay, in the classification he has not mentioned. In the classification he just told 5 types are there, but additionally extra he has mentioned about Vrana Dhumapana in the separate chapter. Okay, he has not included under classification. That is the only thing difference you will be getting. Okay, Sushruta also has mentioned Vrana Dhumapana, but he has not mentioned under the classification, so that you have to make a note. Okay. Then Charaka told 3 types: Prayogika, Snahika, Vairejanika. Okay. Then he has mentioned Kasakna Dhumapana also. Okay, Kasakna Dhumapana also mentioned by Charaka, but he has mentioned in Chikitsa Sthana. Okay, Charaka also described about Kasakna Dhumapana, but he has not mentioned under the classification. Okay, so if they are asking types of Dhumapana according to Charaka, you have to tell 3 only. Okay, but if they are asking Kasakna Dhumapana has mentioned or not, but he has mentioned. Okay, understood, right? So Charaka, basically he has classified Dhumapana into 3 types: Prayogika, Snahika, Vairejanika. But in Chikitsa Sthana extra he has mentioned that Kasakna Dhumapana, like that one more Dhumapana is there, like that he has mentioned it, but not classified, but not he has included under the classification. Okay. Sushruta has additionally mentioned Vrana Dhumapana. Okay, next this Dhuma Netra Pramana Angula. This is very, very important. From these only most of the questions you will be getting. Okay, so Charaka has told 3 types of Dhumapana: Prayogika, Snahika, Vairejanika. Okay, so in this all the types of Netra Pramana, like Angula, if you are studying, this Snahika, Vairejanika is same for all the Acharyas. If you take Ashtanga Hridaya, Vakphata, Sushruta, Sharangadara, this Snahika Dhumapana, like Netra Pramana, Vairejanika Netra Pramana, it is same for all the Acharyas. You can see here. According to Charaka, Snahika Dhumapana Netra Angula is 32. Sushruta is also 32. Sharangadara, it is also 32. Vairejanika is 24. According to Sushruta is also 24. According to Sharangadara, it is also 24. Only the difference you are getting in the Prayogika Dhumapana or otherwise Shamana Dhumapana. In that only you will be getting the differences. Okay, according to Charaka also 3 types of Dhumapana. According to Vakphata also 3 types. Okay, that you can just note down. According to Vakphata, it is 3 types. Okay, according to Vakphata, according to Charaka, Dhumapana, it is of 3 types are there. Okay, so Dhuma Netra Angula Prayogika is 36, Snahika is 32, Vairejanika is 24. But he has mentioned Kasakna Dhumapana also. So that Kasakna Dhumapana Angula you can note down 8 to 10 Angula. Okay, according to Charaka, Kasakna Dhumapana Dhuma Netra Angula is 8 or 10 Angula. 8 or 10 Angula. Okay, according to Sushruta, Prayogika Dhumapana Netra Angula is 48, Snahika is 32, Vairejanika is 24. Kasakna Dhumapana, Vamaga Dhumapana, both are 16 Angula. Okay, so 48 Angula is the Prayogika Dhumapana Netra according to Sushruta. Okay, So in that Sushruta ne Vrana Dhupana Netra ki lambai 8 angula mani hi hai. So Sushruta, he has mentioned Vrana Dhumapana. So according to Sushruta, Vrana Dhumapana angula is 8 angula. Okay, according to Sushruta, Vrana Dhumapana Netra angula is 8 angula. Okay, he has separately mentioned about Vrana Dhumapana and its angula is 8 angula. Okay, 48, Prayogika, Snehika 32, Vairejanika 24, Kasakna and Vamaga is 16, Vrana Dhumapana Netra angula is 8 angula. Okay. According to Sharangadara, Shamana or Prayogika Dhumapana Netra angula is 40. Mrudu and Snehika Dhumapana is 32. Tikshna and Vairejanika Snehapana is 24 angula. Kasakna is 16 angula. So Kasakna Dhumapana Netra angula is 16 for everybody. Okay, except Charaka, Sushruta and Sharangadara both are telling Kasakna Dhumapana is 16 angula. According to Charaka, it is 8 to 10 angula. Vamaga Dhumapana angula is 10 according to Sharangadara, 16 according to Sushruta. Okay, 16 according to Sushruta, Vamaga Dhumapana Netra angula is 10 according to Sharangadara. Then Vrana Dhumapana Netra angula according to Sharangadara, it is 10 angula. Okay, next you have to note down according to Vagbhata's version. Okay, according to Vagbhata, Prayogika Dhumapana Netra angula is 40. Prayogika Dhumapana Netra angula is 40. Snehika Dhumapana Netra angula is 32. Prayogika is 40, Snehika is 32, Vairejanika is 24. Okay. Kasakna 10 angula. Kasakna Dhumapana 10 angula. Vamaga, that is also 10 angula. Like on the classification, only 3 he has mentioned, but separately these 3 Dhumapana also he has mentioned in another chapters. He has described all these 3 things. Okay. Separately he has mentioned about Kasakna Dhumapana, its angula is 10. Vamaga Dhumapana angula is 10. Vrana Dhumapana angula is 8 angula. Vrana Dhumapana Netra angula is 8 angula. So this 8 angula is told by Ashtanga Sangraha. Okay, Vrana Dhumapana Netra angula according to Ashtanga Sangraha 8, according to Ashtanga Hridaya 10 angula. Okay, only in that differences you will be getting. Ashtanga Sangraha is telling Vrana Dhumapana Netra angula is 8. According to Ashtanga Hridaya, Vrana Dhumapana Netra angula is 10 angula. Okay, you can see here. Vagbhata ne Vrana Dhupana Netra ki lambai 10 angula mani hi hai. Okay, Vagbhata here it is indicating Ashtanga Hridaya. So Ashtanga Hridaya he has mentioned Vrana Dhumapana, its Netra angula is 10 angula. According to Ashtanga Sangraha, it is 8 angula. Okay, so this Dhumapana Netra angula is very very important. So in that Snehika Vairejanika is 32 and 24. So you are getting differences in the Prayogika 36, 40, 48. Okay, like that measurements you are getting. And in Kasakna 16 and 10 will be there. Vamakna also 16, 10 is there. Vrana Dhupana 10, 8, like that combinations you are getting. Okay, so these are the Dhumapana Netra Pramana. Okay, basic classification according to Charaka, according to Vagbhata, it is 3 only. According to Sushruta, 5. According to Sharangadara, it is 6. Okay, Prayogika, Snehika, Vairejanika. Sushruta has added additional 2 more Dhumapana, Kasakna and Vamaga. According to Sharangadara, 1 more Vrana Dhumapana. Okay, so these are the types of Dhumapana and its Netra angula. Then Prayogika Dhumapana Kala. Okay, according to Charaka, Prayogika Dhumapana Kala is 8 in number. Okay, when you have to do the Prayogika Dhumapana, that is after the Snana, after taking bath, you can have Prayogika Dhumapana. Bhojana, after the food. Vamana, after the vomiting. Chink, after sneezing. Okay, after sneezing, you can have Dhumapana. Datona, this after teething, after brushing the teeth, you can do Dhumapana. Nasya, after the Nasya karma, after the Anjana, then Nidra ke paschat, after sleep, when you getting up, that time also you can do Prayogika Dhumapana. So these are the 8 times of Prayogika Dhumapana. Okay, so the time they can ask Prayogika Dhumapana Kala, according to Charaka, it is 8 in number. Then Vagbhata. According to Vagbhata, Prayogika Dhumapana Kala is 8. Mrudu Dhumapana Kala is 11. Mrudu means Snaihika. Tikshna or Vairejiniga, that is 5 in number. Okay, the timings, it is very important. Prayogika Dhumapana Kala is 8. Mrudu Dhumapana Kala is 11. Tikshna Dhumapana Kala is 5 in number. Next, according to Sushruta. According to Sushruta, Prayogika Dhumapana Kala is 4. Okay, then the Prakshalana, after brushing. Snana, after taking bath. Bhojana, after taking off the food. Then Shastra Karma Uparanda, after surgery also you can do Prayogika Dhumapana. These are the 4 timings the Prayogika Dhumapana Kala is introduced. Then Snaihika Dhumapana Kala. Snaihika Dhumapana Kala means with the Sneha. With the Snehamsha will be there. That is more commonly we used to give for Vada condition. So whenever the Vada Prakopa usually happen. Mutra Tyaga, after the urination. Okay, after urination Vada Prakopa will be happen. Maiduna, after the sexual intercourse. Shabadu, after sneezing. Hasne, after the laughing. Okay, then Krodha, after this during the anger. Okay, if a severe anger is there, that time also Vada Prakopa will be happen. So in these timings you have to give Snaihika Dhumapana. Okay, Snaihika Dhumapana Kala is 5 in number. Prayogika Dhumapana Kala is 4 in number. Next one is Vairejanika. Okay, Tikshna Dhumapana, that is 3 in number. In 3 times you can do Vairejanika Dhumapana Kala, which are the timings. Snana, after the Nidra, after getting up from the sleep, you can do Vairejanika Dhumapana. Divasopna, after the day sleep. Okay, then Chardi, after vomiting. So these all timings are Kapha Prakopa Lakshanas. Okay, like while getting up from the sleep also there will be Kapha doshas will be there. Divasopna, day sleep. During the day sleep also Kapha will get aggravated. Chardi ke pashad, after the vomiting also that Kapha little bit will be there. Okay, because after vomiting little bit Kapha dosha will be retaining in our body. To remove that you can give Vairejanika Dhumapana. Okay, so these are the timings of the each Dhumapana. In this Snana you have to give importance, because Snana it is comes under 2 category. Prayogika Dhumapana also you can give after the Snana. Vairejanika Dhumapana also we can give after the Snana. Okay, I have told about Snana is bathing. Okay, starting time I have told you about sleep. It is not sleep, it is bathing. After bathing you can give Vairejanika Dhumapana Kala, Prayogika Dhumapana. In both these things Snana is coming, so that you have to make a note. Like maybe they can ask in the exam, in after the bathing which Dhumapana is indicated. So Prayogika Dhumapana is also indicated, Vairejanika Dhumapana is also indicated. Okay, after taking bath these 2 things you can give. Anyone, depends upon the condition you can give. So after the Snana, Prayogika Dhumapana also you can give, Vairejanika Dhumapana is also we can give. Okay, so that you have to keep a note about this. Okay, so these are the Dhumapana Kala. Next one is types of Nidra. According to Charaka, it is 6 types are there. Tamobhava, Sleshma Samudbhava, Manaha Sharira Srama Sambhava, Agantugi, Vyadi Anuvartini, Ratri Swabhava Prabhava. These are the 6 types of Nidra according to Charaka. Okay, tamo bhava, which means if the tamo guna is excessively increased in your body, that time you can get sleep. Sleshma samudbhava, aggravated kapha dosha is there, that time also you can get sleep. Manaha sharira srama sambhava, your mind is exhausted, body is exhausted, in that time also you can get sleep. Then agantugi or otherwise known as rishta, that you can just note down, rishta, rista, rishta. Okay, another name of agantugi is rishta. Then vyadi anuvartini, like due to some of the disorder, if you have suffering with the chronic disorder, that time also we will be getting severe sleep. Then ratri swabhava prabhava, that is a normal sleep. In the night time we used to get normal night sleep is called as ratri swabhava prabhava. Okay, so these are the 6 types of nidra according to Charaka. Okay, Vagbhata is telling 7 types. Okay, the same whatever Charaka has told, the same thing only, but this manaha sharira srama sambhava, you can see according to Charaka. This word he has divided into 2 according to Vagbhata. Okay, he has mentioned as manaha srama sambhava, sharira srama sambhava, like the 2 terms he has mentioned. In that way, Vagbhata has told 7 types of nidra is there. Okay, Vagbhata has mentioned 7 types of nidra. Charagokta manaha sharira srama sambhava ko alag alag karke 7 bhed mane hai. So, manaha sharira srama sambhava, that is one word according to Charaka, but Vagbhata has splitted this word into 2. Manaha srama sambhava, like that one condition, one type. Sharira srama sambhava, one type. Like that he has separated these two, this one word into 2. So, like that 7 will be coming. So, according to Vagbhata, 7 types of nidra. According to Charaka, it is 6 types. Okay, so Vagbhata same whatever Charaka has told, the same thing only, but the manaha sharira srama sambhava he has made into 2. So due to the mental exhaustion also you can get sleep, due to the body exhaustion also you can get sleep. Like that he has differentiated these 2 things. Okay, like that 7 according to Vagbhata. According to Sushruta, 3 types of nidra: Vaishnavi or otherwise known as Swabhavika. Okay, Vaishnavi or otherwise known as Swabhavika. Then Vaigarigi and Tamasi. Okay, Vaishnavi or Swabhavika means normal night sleep. Vaigarigi due to the disorder if you are getting sleep. Tamasi due to the tamo guna aggravated, that time also we will be getting sleep. So like that based on the 3 types. Okay, Vaishnavi or Swabhavika, Vaigarigi, Tamasi, these are the 3 types of nidra according to Sushruta. Next one is Dadi Bheda. Okay, types of Dadi according to Sushruta 7, according to Bhava Prakasha 5. Okay, next one is Adharaniya vega. Adharaniya vega means what are the vegas we have to control. Okay, so that is according to Charaka, it is 13 in number, 1-3. Okay, 13 Adharaniya vegas are there. Okay, which are the 13 Adharaniya vega? Mutra, Purisha, Shukra, Adhovayu, Mutra, Purisha, Shukra, Adhovayu, Chardi, Kshavadu, Udgara, Drimba, Kshut, 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 Pipasa, Bashpa, Nidra, Sramashwasa. Bashpa, Nidra, Sramashwasa. These are the 13 Adharaniya vegas. Okay, which means you should not control these vegas. Okay, so according to Charaka it is 13. According to Vagbhata is also 13. Okay, the same thing only Vagbhata is telling, but instead of Udgara, Vagbhata has mentioned Kasa. Okay, Kasa you should not control. So that is mentioned by Vagbhata. ओके, चरगोक्त उद्गारा के स्थान पर कास का वेग माना है. So instead of udgara he has mentioned kasa vega dharana. Okay, that is mentioned by Vagbhata. Both are telling 13 only, but instead of udgara Vagbhata has mentioned kasa vega dharana. Okay, so in this Adharaniya vega, some important points are there that you can note down. Mutra vega dharana. Okay, in Mutra vega dharana, some conditions we used to get. Okay, in that important points only you can note down. Shiroruja. Okay, if you do Mutra vega dharana, it can result in headache. Shiroruja. Vangshana anaha. Vangshana anaha. Then vinama. Vinama, there is a bending. Okay, if you do Mutra vega dharana, bending of the body will be getting, like if you are controlling urine, our body will slightly will bend. Okay, and there will be bloating also, we can feel it. Okay, so these are the main symptoms which is told in the Mutra vega dharana. Shiroruja, Vangshana anaha, vinama. For the treatment for Mutra vega dharana, Avapida Snehapana is indicated. Very, very important. So Avapida Snehapana is indicated in Mutra vega dharana. Then Trivida Vasti Karma. 3 types of Vasti. Okay, that's all you can do for the Mutra vega dharana. Then next one is Purisha vega dharana. In the Purisha vega dharana Lakshana, the main important Lakshana that you have to focus is Pindigo Dveshtana. Pindigo Dveshtana. That is, you will be getting severe pain in the calf region. Pindigo Dveshtana. Treatment Pramadi Annapana is indicated. Pramadi Annapana is indicated. Then Shukra vega dharana. If you do Shukra vega dharana, Lakshana is Angamarda. Full body pain will be getting Angamarda. Hridvyada. Hridvyada. There will be discomfort in the chest region. Hridvyada. Angamarda, Hridvyada. In the treatment, okay, in the treatment for Shukra vega dharana, Madira has indicated. Madira. Madira means, like, you can think about alcohol. Okay, like that. Madira. Kukkuda. 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 Kukkuda, hen. 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 Then Maiduna is also indicated. Okay, so these are the main treatments for the Shukra vega dharana. If you do Shukra vega dharana, Angamarda, Hridvyada will be getting as a treatment. Madira, Kukkuda, Maiduna, these are all indicated. Then in the Chardi vega dharana, okay, Chardi vega dharana, in the treatment is important. Ruksha Annapana is indicated in Chardi vega dharana. If you are controlling vomiting, you can get like a kandu, kota, like that skin disorders you will be getting. Okay, then as a treatment, Ruksha Annapana is indicated for the Chardi vega dharana. So the Ruksha Annapana is very that is important. Ruksha Annapana, Vyayama, Virejana, these are all indicated in Chardi vega dharana. Ruksha Annapana, Vyayama, Virejana, these are all treatment for the Chardi vega dharana. Then Kshavadu, okay, sneezing. If you are controlling sneezing, Indriya Daurbalya is getting. Okay, so many Lakshanas are there, only important points I am telling. Indriya Daurbalya will be there. As a treatment, Uttara Bhaktiga Grida has mentioned. Uttara Bhaktiga Grida. Like early morning you have to take Gridapana. Okay, before taking the food, you have to take Gridapana. That is indicated in Kshavadu vega dharana. Uttara Bhaktiga Grida, that is indicated in Kshavadu vega dharana Chigilsa. Then another thing is Udgara. Okay, very important. If you do Udgara Vega Dharana, you will be getting Hikka. So the treatment is Hikka Tulya Chikitsa is indicated in Udgara Vega Dharana. So that is very important. Most of the competitive exams we used to get this question. Hikka Tulya Chikitsa is indicated in which Vega Dharana? That is Udgara Vega Dharana. Then in Jrimbha Vega, next one is Jrimbha Vega Dharana. Jrimbha. In Jrimbha Vega Dharana, Vinama is mentioned. As a Lakshana, Vinama is mentioned. Vinama and Aksheba. Vinama, Aksheba. Treatment is Vadakna Aushada. For Jrimbha, Vadakna Aushada is the treatment. Then Pipasa. Next one is Pipasa. If you control Pipasa, Badiriya will be getting. Badiriya. Okay. Sorry. Hearing loss will be there. Loss of hearing you can get if you are controlling Pipasa. Badiriya. Then Hridvyada. Hridvyada. So Hridvyada you are getting in Shukra Vega Dharana and Pipasa Vega Dharana. In these two conditions you are getting Hridvyada. Vinama you are getting in Jrimbha Vega Dharana and in Mutra Vega Dharana. In these two conditions Vinama, Lakshana you are getting. Okay, Badiriya is important one. Badiriya you are getting in Pipasa Vega Dharana. Treatment is Shidapana, like cold drinks you have to take it. Then Bashpa Vega Dharana. In Bashpa Vega Dharana, if you are controlling Bashpa, you will be getting Pradishyaya Hridroga. Pradishyaya Hridroga. Treatment is Madhya. Okay, drinking alcohol is indicated in Bashpa Vega Dharana. Priya Kada. Priya Kada. Good stories. Okay, if you tell good stories to the patient, so he will become pleased, so that Lakshanas will get reduces. So Madhya, Priya Kada, this is indicated in Bashpa Vega Dharana. Then Nidra Vega Dharana. If you do Nidra Vega Dharana, then you will be getting Shiroroga, Akshi Gaurava. Okay, if you are controlling sleep, we used to get headache, no, the next morning. So Akshi, like that, like heaviness of the eye, that type of symptoms you will be getting. Shiroroga, Akshi Gaurava, Tandra. Okay, then what is the treatment? Swapna with the Samvahana. Swapna with the Samvahana. Samvahana means mild massage. Okay, with a mild massage, the patient will go sleep, and through that way we can, whatever the symptoms are, that will become reduces. Swapna with the Samvahana. This is a treatment for the Nidra Vega Dharana. Then Sramashvasa. Sramashvasa. Sramashvasa Vega Dharana Lakshana is Gulma Hridroga. Okay, Gulma is getting in Sramashvasa Vega Dharana. Then as a treatment, Visrama. Treatment is Visrama, rest. You have to take rest, so Sramashvasa we can control it. Okay, that complication will become controlled. So Sramashvasa Vega Dharana, Gulma Hridroga, treatment is Visrama. Then Adhovayu. Okay, if you are controlling Adhovayu, then if you are controlling the Adhovayu, like flatus, if you are controlling, there will be obstruction to the Vada Vit Mutra will be getting. Okay, Klama, that is one of the main symptoms. Klama, there will be fatigue will be there. Klama. And along with it, Vada Vit Mutra Sangha, that also will be there. So in the Chikitsa, Vadanulomana Vasti Bhojana and Pana is indicated. Okay, if you are controlling Adhovayu, Vada Vit Mutra Sangha will be there. Klama will be getting. As a treatment, Vadanulomana Vasti Bhojana Pana is indicated. Okay, so these are the important points related with the Dharaniya, like Adharaniya Vegas. Okay, these 13 Adharaniya Vegas you should not control. Okay, if you are controlling, these are the problems will be there, and these are the treatments you have to give in these conditions. Okay, next one is Adharaniya vega. Okay, Dharaniya, which are the things which you should control. Okay, according to Charaka, it is 14, 1, 4. Dharaniya vegas are 14, 1, 4. Not 14, 18, 1, 8, sorry. 1, 8, 18. Okay, Dharaniya vegas are 18 in number according to Charaka. 18. Okay, so these are the things they have mentioned in the first page. Okay, so Dhumapana, all the things they have mentioned: Dhumapana, Netra, Angula, Kala, then Nidra types, then Adharaniya vega. These are all mentioned in the first page. Next one is second page. In the second page, they have started with the Sneha Pravijarana. Okay, for some people they can't take the pure Sneha. Okay, they will like children, they don't take the pure ghee for the Sneha Pana, or this children's, they don't take it. Some people, they have an aversion to the grida. So this type of people, how we have to do Sneha Pana? We have to mix it with the food. We have to mix it with the this medicines. Like that, we will be introducing this Sneha. That is called Pravijarana Sneha. Okay, those who are aversion to the Sneha, those who don't want to like children. Okay, so such type of people, they don't take this Sneha. As a pure Sneha, they don't take it. So such for them, if you wanted to give Sneha Pana, so you can mix it with the food, you can mix it with the as a treatment you can give, or mix it with some medicines you can give. Like that, if you are giving Sneha Pana, that is called Pravicharana Sneha. According to Charaka, 24 Pravicharana Snehas are there, and based on the Rasa, 64 is also he has mentioned. Okay, two types of Pravijarana Sneha he has mentioned. 24. 24 means like mixing with the food, mixing with the treatments. Like that, if you are giving Sneha Pana, that is total 24 Pravijarana Snehas are there. Then based on the combination of Rasa, also Pravijarana Sneha he has mentioned, that is 64. Okay, Rasa Bhedena 64, and based on the treatment and the food particle, 24. Okay, 64 Rasa Bhedena, 24 with the food and treatment parts. Like that, two Pravijarana Sneha they have mentioned. Okay, according to Rasa Bhedena, like that only question is coming, 64 you have to choose. Vagbhata also 64 Pravijarana Sneha based on the Rasa. According to Kashyapa, 20 Pravijarana Snehas are mentioned. Okay, next one is Svedana. Okay, types of Svedana. We all know that basically Svedana, it is divided into two: Agni Sveda and Nirakni Sveda. Okay, according to Charaka, Agni Sveda is 13 in number. Okay, Sushruda's version is 4. Okay, Sushruda is 4 has mentioned. Vagbhata is also 4, and Kashyapa is 8. That you can just note down. According to Kashyapa, Sa Agni Sveda is 8 in number. Okay, Sushruta and Vagbhata both are telling same only, Sa Agni Sveda, that is Drava, Taba, Ushma, Upanaha. Drava, Taba, Ushma, Upanaha. These are the 4 Sa Agni Sveda according to Sushruta, according to Vagbhata. Okay, Drava, Taba, Ushma, Upanaha. According to Charaka, 13 Sa Agni Svedas are there, that you can just note down. Sangara, Prastara, Nadi Parishega, Avagaha, Jayandaga, Ashmakna, 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 Sangara, Prastara, Nadi, Parishega, Avagaha, Jayandaga, Ashmakna, Karshu, 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 Kuti, Kuti, Bhu, 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 Kumbi, Kumbi, Kuba, Holaga. Karshu, Kudi, Bhu, Kumbi, Kuba, Holaga. These are the 13 types of Sa Agni Sveda. Numbers are very, very important. Okay, numbers, it's very important according to Charaka 13, according to Sushruta, Vakpata 4, according to Kashyapa 8 Sa Agni Sveda. Okay. Then Niragni Sveda according to Charaka 10, according to Sushruta 8. Okay. According to Charaka 10, according to Sushruta, Niragni Sveda is 8. So the 10 Niragni Sveda that you can just note down. Vyayama, Ushna Sadana, Vyayama, Ushna Sadana, Guru Pravarana, Guru Pravarana, Kshut, 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 Bahupana, Bhaya, Bahupana, Bhaya, Krodha, Upanaha, Ahava, Atapa. Vyayama, Ushna Sadana, Guru Pravarana, Kshut, Bahupana, Bhaya, Krodha, Upanaha, Ahava, Atapa. These are the 10 Niragni Sveda according to Charaka. Okay, so in that one point you can see Upanaha. Okay, according to Charaka, Upanaha comes under the Niragni Sveda. But according to Sushruta and Vakpata, according to Sushruta, Upanaha comes under the Sa Agni Sveda. Okay, according to Charaka, Upanaha comes under the Niragni Sveda. According to Sushruta, it comes under the Sa Agni Sveda. But Vakpata, he has mentioned in both the things. In Sa Agni Sveda also he has mentioned Upanaha. In Niragni Sveda also he has mentioned Upanaha Karma. Okay, so according to Vakpata, in both the things he has mentioned. Okay, according to Vakpata, it is Niragni, it is both Niragni and Sa Agni. But according to Sushruta, it is a Sa Agni Sveda. But according to Charaka, it is a Niragni Sveda. Okay, that one you have to give importance. Then Niragni Sveda is also 10 in number. Langhana, that is also 10 in number. Fasting, Langhana. Okay, Langhana karma is there. Charaka has told Langhana, 10 types of Langhana karma he has mentioned. Okay, so the 10 types of Langhana is Chadushpragara Samshuddhi. The first one is, the first 4 is this Shodhana. Okay, Chadushpragara Samshuddhi. Okay, 4 types of Shodhana. Pipasa, 10 types of Langhana, that is Chadushpragara Samshuddhi, which means 4 types of that Shodhana karma, Vamana, Virejana, Nasya, Basti. Then Pipasa, Maruda, Atapa. Pipasa, Maruda, Atapa. Pajana, Upavasa, Vyayama. Pajana, Upavasa, Vyayama. These are the 10 types of Langhana karma. Okay, Langhana also 10 types are there. Okay, Chadushpragara Samshuddhi, 4 types of Panchakarma, then 4 types of Shodhana. Okay, then Pipasa, Maruda, Atapa, Pajana, Upavasa, Vyayama. So these are the 10 types of Langhana. So in that Vyayama, Atapa, okay, these two things are comes under the Niragni Sveda also. Okay, Vyayama, Atapa is common to the Niragni Sveda. So that type of common things you have to make a note. Okay, so Vyayama, Atapa both are common in Niragni Sveda and Langhana. Okay, in Langhana, Upavasa has mentioned. Upavasa means what? Fasting. Right. In Niragni Sveda also the same thing you can see. Kshuddha. Okay, Kshut, Kshut. Okay, that is also fasting. Both are same meaning only. but the term has differently they have used. In Langhana, Upavasa they have mentioned, in Nirakni, Kshut has mentioned. Okay, so this type of things just you have to give focus. Then in the Svedana, another one important thing they used to, most of the time they used to ask is Amashaya Gadavada. In Amashaya Gadavada, how we have to give the Svedana. Okay, in Amashaya Gadavada, first of all, Rukshana, then followed by Snigdha Sveda has to be given. In Amashaya Gadavada, first Rukshana, then Snigdha Sveda has to be given. Okay, in Amashya means you can just think about Amashya, that will be Kafasthana, like more Kafa will be there. Okay, in Amashya. So first of all we have to treat the Kafa. For that Rukshana has to be given. Then after followed by Rukshana, then it will become little bit Vada dosha will be there. So for that Snigdha Sveda has to be given. Okay, in that way you can remember. So in Amashya Gadavada, first of all Rukshana, then followed by Snigdha Sveda has to be given. Then Pakvashaya Gada Kafa. Next one condition is Pakvashaya Gada Kafa. In Pakvashaya Gada Kafa, first of all Snigdha Sveda, then followed by Ruksha Sveda has to be given. Snigdha Sveda, then followed by Ruksha Sveda has to be given in Pakvashaya Gada Kafa. Okay, that also, these two things also, most of the competitive exams we can see. This type of question they used to ask. So, Pakvashaya Gada Kafa means Pakvashaya Vada Sthana. So, we have to treat Vada. So, Snigdha Sveda first of all. Then Kafa. So, Ruksha Sveda has to be given. Okay, so this also most of the time we used to get questions related with the Svedana. Then another Svedana is also there. Vrishana, Hridaya, Drishti. Okay, Vrishana, Hridaya, Drishti. In these three areas we should not do Svedana Karma. Vrishana, Hridaya, Drishti. In these three places Svedana Karma is contraindicated. In case if emergency we can do Mridu Sveda. In Vankshana, Madhyama Sveda is indicated. In Vankshana, Madhyama Sveda is indicated. Then another thing is Adiyoga of Sveda. In case if you have given Svedana Karma excessively, in that condition, Grishma Ruducharya has to be followed. This is also we used to get a question. Okay. Whenever you have done Svedana Karma excessively, so in that time Adiyoga, Grishma Ruducharya has to be followed. Okay, so these are some important points related with the Svedana Karma. Okay, so basically Sa, Agni, Nirakni, Sveda classification on the number only they used to ask. So in that some important points. Upanaha. Okay, Upanaha according to Charaga it comes under the Nirakni. According to Susruta it is a Sa, Agni. According to Vakphata in both the things he has mentioned. Okay, according to Charaga Nirakni Sveda is 10 in number. Sa, Agni Sveda is 13 in number. Then Shiroroga. Shiroroga according to Charaga 5, Vada Pitta Kapha Sannipadaja Krimija. According to Susruta it is 11 in number. Vada Pitta Kapha Sannipadaja Kshayaja Krimija Suryavarta Anandavada Ardhava Bhedaga Shankhaga. Okay, so these are the 11 types of Shiroroga according to Susruta. Madhav Nidana also 11, Vakphata 10. Vakphata actually he has mentioned total 19 Shiroroga. So 10 Shiroroga, 9 Kapala Roga. Like that one classification mentioned by Vakphata. Okay, 10 Shiroroga plus 9 Kapala Roga. Okay. So like that of classification mentioned by Shiroroga. Okay. Then Hridroga according to Charaga it is 5. Vada Pitta Kapha Sannipadaja Krimija. According to Susruta it is 4. Vada Pitta Kapha Krimija. So Sannipadaja he has not mentioned. Okay, Sannipadaja Hridroga has not mentioned by Sushruta. Okay, next one is Prameha Pidaka. So if you are not controlling Prameha Roga, it can lead to Pidaka, like boils you can get in the body. Okay, so that is the main thing. Like Madhumeha, if you are not controlling properly, so it leads to Medo Dushti and Vada Dosha Avarana. Medo Dushti, Vada Dosha Avarana, it leads to the Pidaka formation. Okay, how the Prameha Pidaka is forming? Prameha, if we are not controlling properly, it leads to Medo Dushti, and because of that Vada Pragopa will be happening. So these all will be combining and joining. It will lead to boils in the body. According to Charaka, 7 Prameha Pidakas are there. According to Sushruta, according to Vakphata, it is 10 in number. Okay, so Pidaka names you can just note down. Sharavika, Kachapika, Jalini, Sharavika, Kachapika, Jalini, Sarshapi, Alaji, Vinada. Sarshapi, Alaji, Vinada, and the last one is Vidradi. Last one is Vidradi. Sharavika, Kachapika, Jalini, Sarshapi, Alaji, Vinada, Vidradi. These are the 7 types of Prameha Pidaka according to Charaka. Sushruta and Vakphata, additionally 3 more Pidaka they have added. The 3 additional Pidakas are Masurika, Putrini, Vidarika. Masurika, Putrini, Vidarika. Okay, so these are the 10 Prameha Pidaka according to Sushruta and according to Vakphata. Okay, so the first 3, Sharavika, Kachapika, Jalini, these are all Kapha and Medo Dushti. Because of these things, you will be getting this these 3 Pidakas. Okay, Kaphaja due to Kapha dosha and due to the Medo dosha. The first 3 Pidaka, Sharavika, Kachapika, Jalini, these are all formed by due to Kapha dosha and due to the Medo Dhatu. And the last 4, Sarshapika, Alaji, Vinada, Vidradi. These are all happen because of the Pitta dosha and Alpa Medo Dushti. Here little bit only Medo Dushti is happening. Alpa Medo Dushti. The last 4, Sarshapi, Alaji, Vinada, Vidradi. These 4 Prameha Pidaka is formed due to Pitta dosha and Alpa Medo Dushti. So because of that, these 4 Prameha Pidaka is Sadhya. Okay, the last 4 Prameha Pidaka is Sadhya. Because Alpa Meda Dushti is happening and Pitta dosha is getting vitiated. Then Vidradi, it is of 2 types Charaka has mentioned. Okay, the last one, last Prameha Pidaka Vidradi, it is of 2 types are there, Bahya and Abhyandara. Okay. Then according to Kashyapa also Prameha Pidaka 8 in number. Whatever the Charaka has told 7 plus he has additionally added Arumshika. Okay. Then Bhoja, he has also mentioned 9 Prameha Pidaka. Okay, he has not added Vinada. Okay, Bhoja, he has mentioned 9 Prameha Pidaka. Only 1 Prameha Pidaka he has not added, that is Vinada. Vinada he has not added. Then instead of Masurika he has mentioned Kulattika. Instead of Masurika Prameha Pidaka, instead of that he has mentioned Kulattika. Okay, so that is told by Bhoja. So Bhoja, according to Bhoja, Prameha Pidaka, it is 9 in number. He has not added Vinada, and instead of Masurika, he has added Kulattika. And Kashyapa, additionally, he has added Arumshika. Okay, rest of the things we'll discuss on the next class.